All right, so let's talk now about some disorders that are systemic, but that they affect the respiratory tract pretty heavily. First is infectious mononucleosis, or mono. This is caused by the Epstein-Barr virus, which is transmitted in saliva. This is why adolescents and young adults are some of the highest have some of the highest levels of infection, because they share drinks all the time. There's a 3 to 50 day incubation. So this can take forever to go through a group of kids. And by the time one kid has it, a lot of other kids have often been exposed. It has a really long incubation and a really long convalescence. It can take weeks to recover. So what does it look like in the acute phase? They may have fever, usually not super high, but they may have fever. They have exudative pharyngitis. So they have a sore throat with exudate. Lymphadenopathy, so their lymph nodes swell. Liver and spleen may swell. On CBC, they have increased atypical lymphocytes. They feel fatigue, and that's one of the most profound symptoms. They're just exhausted. They come home and crash, and they just can't move. So they're fatigued. They may have a headache. They may have petechia on the palate. They may have a macular rash across the cheeks and on the face, and they may have a poor appetite. Medical management for it's diagnosed by antibody testing. It is self-limited, and so supportive care is what's done. Nursing care, we want to promote comfort and limit transmission and teach home care. The one thing to remember about mono is if their spleen is enlarged, we need to limit their activity until it's back to normal size. Mono or Epstein-Barr virus is also associated with chronic fatigue syndrome. Tuberculosis. This is caused by a specific bacterium, Mycobacterium tuberculosis. It is respiratory transmission. It is a very, very slow growing bug. An exposed patient may or may not get the disease, and if they do, they may or may not develop symptoms. The risk factors: you're more likely to get sick if exposed if you're immunocompromised, if you live in crowded conditions, or you're in an area that has endemic TB, the risk of exposure is higher. Pathophysiology: so the organism enters through the airway, and epithelial cells proliferate to wall it off, and that makes a tubercle. The tubercle extends, and that causes tissue damage. The tubercle also sheds this material that transmits or spreads the bacillus, the organism, through the lung tissue. If that tubercle erodes through a blood vessel, we're going to see hemoptysis, but also the bacillus can enter the bloodstream and get to other sites in the body. So what does it look like? Cough. Malaise, remember, is the feel bads: fever, weight loss, night sweats, hemoptysis, and then they may have symptoms related to invasion of other organs. This is diagnosed in a couple of ways. So a positive skin test indicates that that person has had an infection. If they also have clinical symptoms or a chest x-ray that shows tubercles, that indicates an active infection. A latent infection is if they have a positive skin test and no clinical manifestations. The majority of people with a positive skin test do not go on to develop the disease. They can spread the disease when they have respiratory symptoms. There are several medications that are given for TB, and you get more in depth into this next semester. All of those meds have significant side effects. All of them have to be taken for a long time, several months. And so compliance tends to be low. People don't finish their meds. They don't feel well, so they don't take their meds. They forget them. They don't get them filled. They're also kind of expensive. Some of them are really expensive. And so people don't always finish their meds, and that has led to resistant strains of TB. Surgery may be done to remove a focus of infection that can't be reached by medication, and it may be used to correct any deformities that were caused by meds. by the infection. Nursing care, this is respiratory precautions with N95. If they're admitted, they need a negative pressure room. If they have no cough and their sputum is negative, they don't need precautions. Kids who are asymptomatic and taking their meds can attend school and daycare. Nurses might be administering those TB skin tests. We might be participating in something called direct observation of therapy, when patients come in daily and take their meds under observation. That tends to increase compliance and decrease relapse, which decreases drug resistance. Teaching, we want to teach about completing therapy and transmission-based precautions, and we might also be involved in contact tracing and case finding. Okay, we'll talk about cystic fibrosis in the next section.